Hi, I'm Margie Dangerfield. I'm a registered nurse, midwife, and independent Zeno partner. And I've helped almost 3,000 people using Zeno's personalised test-based nutrition. In this video, I bring you an industry leader, an expert in their field, who is integrating Zeno's test-based approach in their clinical practice. So if you're ready to move beyond guesswork and elevate your patient outcomes with our precision-driven strategies, you're in the right place.
So, good evening, everyone. My name's Im Quah-Smith, and I'm a doctor in Sydney, Australia. Today, we're going to talk about the vagus nervous system, the information freeway extraordinaire. First of all, we're here because Margie is really passionate about xenobiotic, and so am I. And xenobiotic in mucosal health has been very well presented by Dr. Paul Clayton, Chief Scientific Officer at Xeno. And I would say refer to Paul Clayton's excellent presentations. What I want to say is we need to strive for efficiency of the work to be done at the mucosa. We need to make sure that the mucosal membrane needs to be structurally optimized in with nutrition to the cells and out with cellular waste products. And we know from the dry blood test that we should try to aim for an omega-6 to omega-3 ratio of 3:1 or better. So this evening, the vagus nervous system is what we're going to talk about and how it links all cells. The vagus status is quantifiable using the VAS, or vascular autonomic signal, to measure the vagal upload time at the auricle, which I will show you in a slide in a moment. And to understand that chronic inflammation is pretty synonymous with vagal dysregulation. If you can get chronic inflammation under control, the vagus nerve behaves well and supports you beautifully. And if you've got the other way around, vagal dysregulation, chronic inflammation will flare up. Recovery is measured by the reduction in VUT, or vagal upload time. I want to also briefly talk about the importance of good sleep, and also to briefly mention the results of the MRP, or Metabolic Recovery Programme, in 2024. The MRP was a program that my company, Roseville Wellness Group, and Dr. Makri's company, Diet Praxis in Athens, collaborated on, where we use xenobiotic and balanced oil and RJL transdermal laser for lymphatic drainage to improve patient health outcomes. So what does the vagus really do? It's autonomic, which means automatic controls. I love speaking in plain English because this is what we want to do when we're trying to explain to patients or to your clients. The whole idea is to keep the organism, which is us, running efficiently. It's all about survival. Breathing, heart rate, to eat or not eat, to sleep or not sleep, to cool down or warm up. The vagus is the most amazing communication systems between the brain and the furthest reaches of the body. Importantly, the last vestige or evidence of the vagus is found at the SCN, or suprachiasmatic nucleus of the hypothalamus. We're just going to now talk about sleep regulation. This SCN, or suprachiasmatic nucleus, is integral in sleep regulation. It's a bilateral structure located in the anterior part of the hypothalamus, and it is the central pacemaker of the circadian timing system and regulates most circadian rhythms in the body. And it also has a part to play in Alzheimer's disease and Parkinson's. If you sleep well through most of your life, you are more likely to protect yourself from getting or presenting with Alzheimer's disease late in your life, or Parkinson's disease as well. Here, we're just going to briefly talk about the SCN. I've got a lovely picture here. I will show you what we're talking about. So during the daytime, just follow the cursor. Light comes in, it targets the retina, and the signals go through the optic nerve to the SCN, and we know it's awake time. At nighttime, with darkness, what happens is the suprachiasmatic nucleus then signals when there's dusk or darkness. It will signal the pineal gland will signal the pineal gland to then produce or release melatonin, which is a hormone that tells the body darkness has arrived. And as we get older, the production of melatonin decreases. So it is a helpful tool to actually supplement melatonin when we have sleep dysfunctions. And just have a look here at the time structure, 8 p.m., 10 p.m., and that's 11, and that's midnight. So we can see things happen with every 2 hours along the way in the 24-hour clock. Here we have from about 11 p.m., we should be trying to be in bed by around 10-ish, reading in bed, etc., not being faced with blue light, and we'll explain why not in a moment. And we want to be asleep by 11 p.m.-ish, and during that time is when tissue repair happens. So your cells get replaced, your cells get repaired during sleep time. It's not the same thing to have an afternoon nap. You must make sure to stay well, healthy for longer. You need to have deep sleep, good quality sleep overnight. And the deeper sleep has to happen from 2 a.m. onwards. You can see now the melatonin population too increases its functionality, increases sleep regulation at the SCN. And this is when deep sleep happens and tissue repair happens, and also the lymphatics of the brain works away to clear the rubbish, the waste products from the brain cells, and clears it through your cervical lymph nodes to clear down through the whole cycle of lymphatic drainage. So with sleep debt or sleep deprivation, we talk about brain fog, very topical now in the news. When you look at your phone and read the news, people talking about why are more people getting brain fog these days. You get brain fog and inefficiency from lack of sleep. You get delayed reflexes while driving or operating equipment and machinery. Inflammatory processes are triggered and your belly fat will grow. And really, belly fat is about adipose tissue that's really little centers of inflammatory change. So it's important, if you cut down the inflammation, the belly fat should reduce. And that includes, of course, good sleep overnight. Aim for that always. The inflammatory processes triggered also include joint changes, stiff joints, and enlarged joints. It can also trigger chronic vascular disease, sticky blood vessels, and cholesterol plaques. And things like growth hormones, cellular replacement, and repair happens during deep sleep, and all those things get disrupted as well. Here's the blue light exposure thing, which I think is relevant in this day and age because we all have smartphones, we have iPads, we have giant screens to watch our Netflix or our Stan or whatever other program you're watching on television. Huge exposure to blue light these days. Blue light exposure delays sleepiness or sleep drop-off time. This is just a slide from a project by the Johns Hopkins School of Public Health and their partners. So if you take a look at this, the more blue light you have, the longer it takes for deep sleep to happen. So if you have candle light and nighttime, have as minimal light as possible. So candle light is 0 drop-off time, as you can see over here. Incandescent lamp, old-fashioned lamps and globes would be 55-minute drop-off time. And e-reader like Kindle is 58 minutes drop-off time, but it's getting more and more delayed. And the smartphone will take you over an hour to get deep sleep drop-off. And by the time you use your tablet or your iPad, it's 96 minutes. And it's over 2 hours if you're watching television on a huge 54, 58 centimeter screen. Here, I want to share with you a slide with from my friend and colleague, Dr. Franca Deru. Sorry about the typo there. Should be Franca, F-R-A-N-C-A. She's a lady. Dr. Deru, Franca's slide. She works, she's a neurophysiologist at the University of Sassari in Sardinia in Italy. And we worked together a few years ago in about 2017. And it goes to show she works a lot on cranial nerve 10, which is the vagus, and cranial nerve 5, which is the trigeminal nerve. Here we want to focus on cranial nerve 10. So VN fibers means cranial nerve 10 fibers. And when I work with my patients, I target and I quantify how disadvantaged or how tired the vagus nervous system is by measuring the vagus upload time at the concha, which is the hollow of the ear. And that's the usual region where I would use my laser, and I target my laser at the vagal nerve region, which is optimal for me to start introducing the laser signal. And I work out in seconds how long it takes to actually improve the VAS, or the vagal autonomic signal, which I'll show you in a minute. But focusing on this slide, let's just gradually work through this very busy slide. So we've got the vagus nerve here, and to look at this, the afferent to efferent, meaning the number of signals going into the brain via the vagus nerve, is 4 times that of the signals coming out, meaning it's all about every single corner of your brain, every single corner of your body. You've got vagal signaling happening. It's like the tentacles that actually work out what is happening in the furthest reaches of the body down to your last toes, which are all being sent signals up to the brain, so the brain knows what is going on way out there. So there's a lot of efferents coming in with the cranial nerve 10, and 65 to 80% is C fibers, which are to do with pain sensation, but mostly it is all about automatic nervous signaling. So the vagus nerve sends signals to a little body called the NTS, or nucleus tractus solitarius, which then goes into the red nucleus and the locus coeruleus, and from there we can see it signals up to the hypothalamus. Remember, that's where the SCN is, but the hypothalamus controls all endocrine or hormonal function. And from there, the signaling continues further up to the thalamic nuclei, and from the thalamic nuclei, the reaches go right across the board through the cerebellum, the back of the brain, the amygdala, hippocampus, home of post-traumatic stress or negative memory changes. And the neocortex is really about the entire brain, from the front to the back of the brain. The front brain, or frontal cortex or prefrontal cortex, is all about sense of self in psychological terms, or sense of creativity, where you want to go in life. So you have some clarity about what you want to achieve from day to day or from year to year. And the parieto-temporal cortex is about somatization, or when things go wrong, things don't go your way, you get physical symptomatology from the negative events or the lack of clarity with where you want to go in life. And the posterior brain is not just about balance and proprioception. The cerebellum has got its own limbic system for emotion. And the posterior brain is also about holding, in psychological terms, holding duty, financial burden, family burden, all kinds of burden is actually buried in the posterior brain of the body. The thalamus here, this is ventral-posterior medial thalamus, is more emotional stuff happening, and pain management as well. But in this whole feedback between brain regions, talking down then to the rest of the body, you see the vagus signals go up, it just scrambles through here, fixes up what needs to be fixed up when it's running well, and the signals then go back to the body through the efferent projections. The afferents are in, efferents is going out. You don't actually need to have any neurological structures at all. It can go through bloodstream in the sense of hormones. It can go through neurological structures, or it can go through hormonal interventions or through the immune system. Activation of C fibers is not required for cranial nerve 10 or even cranial nerve 5. Now, let's just have a look here at how all these interactions involve how we feel every day. About vigilance. If things are running well, you don't get hypervigilant. If you've had a lot of trauma and shock, you can become hypervigilant, and that's when we get PTSD, or post-traumatic stress disorder. Pain or no pain signals. I like to always say to my patients, every one of us have got one black box for pain. Emotional pain and physical pain are all together in one black box in the body. So when you have an emotional circumstance, it will flare up your physical pain. If you have physical pain, it will flare up your emotional trauma as well. So it's a two-way street always. So from pain, we'll go on to emotions. We've just mentioned that, on mood, good mood or low mood. anxiety, all linked to vagus. It's not just, so have to always think, instead of going straight away to an anxiolytic drug, have a think, is it something structural that can be improved? How can you help the vagus improve its status or its well-being? And when you do that, you'll also reduce anxiety in the individual. Selective attention, cognitive processing, that's the front brain stuff. The propensity to seizures, that's not relevant to this talk today. Memory, which is front brain to back brain. Metabolism, which is about whether you run the body well, or it's got plenty of energy, or whether it's holding back on energy, it's not running so efficiently. All, of course, relevant to what we're talking about when we do Zinzino. Food intake as well. So that's where we are. And just this is just a slide to show color coordinated. The vagus is in the contour of the ear. It's in the pink, and the trigeminal nerve is in the blue part of the ear. Okay, next slide. So treating chronic inflammation with Zinzino Balance Oil and Xenobiotic. This is our project that we mentioned briefly before, the MRP, and Dr. Makri and I decided we had to do this. We actually were at a mitochondrial medicine conference run by Dr. Michael Weber in Portugal when we got together and decided this is too much chronic inflammation, too many chronic diseases in the world today, that we had to think of something more positive, more definitive, more where we can quantify what the hell's going on to get patients better. In general, just getting patients to feel better and addressing their chronic inflammation. So, chronic stress contributes to many disorders and diseases, sleep changes, insomnia, we've touched on that, vascular changes, blood pressure goes up, endothelial changes happen, cholesterol plaques happen, metabolic changes, weight gain, everyone's getting the middle age spread. What can we do about it? You know, doing so much exercise and you still got the belly fat, insulin resistance happening. We also get muscular tendinous changes, increased myofascial tension. So you get head and neck tension, or you get lower back problems, or sciatica, or gluteal tension, or very tight calves when you're trying to exercise. Functional connectivity, this is what I call when I'm doing laser for brain work, functional connectivity, just making sure every section of the brain from front to back is running well and quantifying every single section. I do that at the ear. So functional connectivity will change. You'll find your focus will go with chronic stress, your concentration, your memory ability will go. And many times people say, do you think I'm getting dementia? The patients will say, but then you take their history, make sure you look them eye in the eye, you're listening carefully, face-to-face contact. Don't just be driving the whole consult with just typing away at your computer. Look at them, sit and listen to them. You learn so much just by observing and listening to people and looking people in the eye. You will find, I tell them, when you are super stressed and overloaded and near burnt out or burnout, you'll find your memory will go anyway, because everything's just not firing on all 6 cylinders. So expect some memory change. It doesn't have to be Alzheimer's, doesn't have to be some neurodegenerative change happening for the long term. It is possible to correct it. Vagal dysregulation with stress, we know autonomic overload. We've just spent the last 15 minutes talking about that. And importantly, we don't spend enough time in general as clinicians to talk about glymphatic. G-lymphatic is the lymphatics of the brain, and this is what helps clear the waste products of the brain cells at night in deep sleep. So you have to make sure that lymphatics are draining, and then when it drains, you have to make sure head and neck tension is not so tight that the lymphatics can't drain back to the general lymphatics of the whole rest of the body. So lymphatic and lymphatic congestion is very important to keep it running well, because that helps clear the waste products of the brain and the rest of the body. Chronic stress will alter its ability to do so. So vagal dysregulation, it happens when you have prolonged stressors, because it is, after all, the automatic nervous system that helps the brain understand what's going out there in the periphery, and the periphery to tell the brain what is going on out there. So with prolonged stress, prolonged stressors, post-infection, vaccine injury, neglect, or post-operatively, the vagal dysregulation can happen. And we can quantify at the auricle using the VAS how bad it is. We know then, I've just mentioned that the concha is endodermal germ cell derived vagal state. It's the ideal access to very quickly quantify what is going on and how long is it going to take to improve someone's symptomatology or quality of life. VUT with the MRP project, we measured the vagal upload time before and after. So we do the dry blood test for working out what the inflammation state is. And at the same time, we measure what the vagal upload time is. And then we measure it. I'm so sorry, it's not 12 weeks, it's 20 weeks, 120 days later as instructed. We work out what the vagal upload time is after that. So symptoms we're trying to improve are anxiety, agitation, gut changes, sleep disturbances, nausea, vertigo, and fatigue. Dr. Makri, based on uses some of her Greek heritage to work out in this system what each individual patient's genetics are, epigenetics are. And it's based on the theory of Pythagoras and Hippocrates, and using Hippocrates' theory of humors to modern metabolomics, looking at three aspects of the organism: how much energy delivery there is, what's the metabolic rate, and what is the organic function of the individual. So metabolomics, when the food isn't consumed properly, can lead to endotoxification and chronic inflammation from Th1, Th2 imbalance. That's T lymphocyte 1, T lymphocyte 2. And we want that balance because T lymphocyte 1 is about attacking the virus or the bacteria entering the body, and then it has to have a mechanism to stop it completely going out of control. So T lymphocyte 2 helps control T lymphocyte 1. However, T lymphocyte 2 hasn't got a control mechanism to slow it down. So if it goes out of control, that's when we get autoimmune disorders and the individual's immune system is attacking itself. Foods are selected according to the individual's temperament in combination with the dry blood test to work out what their omega-6 to omega-3 ratio is. And from her ability to use mathematics, to use Pythagoras and Hippocrates, she then teaches the individual patient about their temperament, which is a combination of genetic and physical characteristics and mental, emotional, and spiritual attributes. So a personality is shaped by various traits: dominant temperament or genetic temperament, emotional temperament, and their psychological or mental state at the time, or their physical or phenotype temperament. So she's able to then counsel them what they should aim for in their diet and what they should aim for and look out for that will stress their system up because of their genetics and their traits and their epigenetic environmental changes that can make themselves feel good or make each patient feel bad. And that's quite interesting, and I've learned a lot about it. And I'm sure at some stage, Dr. Makri will give an entire talk about this as well. Moving on. So quantifying the vagal dysregulation. So I use something called the VAS, the vascular autonomic signal, which I learned from the Lyonnais School of Medicine, taught to me by Dr. Raphael Naugier. This is something which is very familiar for a lot of Europeans, clinicians in France, in Italy and Germany. They use the VAS a lot. Now it's slowly, I'm hoping to introduce it to clinicians in Australia, and also it's also used in the States as well. So on the right, you'll see this little graph here, the VAS, with Professor Gerhard Lietzer at the University of Graz, Austria. He's now Emeritus Professor Gerhard Lietzer. He was able to show with his biomedical engineering background that the VAS does exist and you can measure it. So it is actually a glitch that happens. It does like an increased amplitude and then it drops down and it continues. It's usually measured at the radial pulse, traditionally using the thumb. It is best to choose the finger pulse because it's most sensitive, I find for myself. The VAS is both diagnostic and therapeutic. You palpate it at the radial pulse is easiest. If it's a full pulse, high amplitude, then there's a neurophysiological dysfunction. And then you'll find that change happens in that part of the body where the crisis or the dysfunctional state is. Whether you're using the VAS to locate an acupuncture point that needs to be treated, or whether you use the VAS to locate in your friend who's fallen over while you're out on a hike or a bushwalk and has got some damage, done some damage to himself or herself, you can work out exactly where the destruction or the trauma is that's happened, whether it's a fracture or whether it's a tear of some sort in the muscle. So it's a very helpful tool which disappears when you have corrected the problem. Pulse resolution to normal amplitude upon adequate laser upload or adequate duration of therapeutic modality. So if you're doing needle acupuncture needles, if you're using laser therapy, the laser therapy, after you've done that, you'll find the VAS will go back to normal sine wave instead of being a sawtooth wave. Traditionally, it's used in auricular medicine, but it's applicable to the entire body. And it can be used to accurately detect an acupuncture point, like in some styles of Japanese light needling, you actually use the VAS a lot. So this is the MRP project that Dr. Makri and I did. We had 29 patients, and we did this at the beginning of last year. And across the group, the median age was 64 years old. There were 6 males, a little bit less than usual. Normally, it's 30% males and 60% females. So 6 males and 23 females at this time joined the program. Median age of the men was 58 years old, and median age of the women was 66 years old. The presenting problems in these 29 people were 2 people had long-standing alopecia. One had hair, but it was falling out in clumps. The other one had half the head very shiny pate because a lot of the hair had fallen out. There was chronic stressors behind both histories. We had 2 long COVID patients with severe fatigue and brain fog. We have cancer lymphatic changes post-operatively, post-chemotherapy, post-radiation, 3 patients like that. And chronic recurrent musculoskeletal changes, complaining of sciatica or lower back pain or chronic frozen shoulder in 4 patients, insomnia in 6 patients, that's quite a large number in a scheme of 29, and chronic stress in 8, a large number as well, and chronic gut changes, bloating, bowel dysfunction in 3, and they had 1 autoimmune, very interesting case, wasn't what you expect, lupus or something severe like that. It was a lovely Italian lady in her mid-80s with her blepharitis, chronic autoimmune change in her eyelids, bright red, inflamed, but steroids didn't help at all. So that was quite interesting. We took her on as well. So here we find the outcome, the results of the omega-6, omega-3 ratio. We find whatever their counts are, the ratio omega-6 to 3, that's up there. And over 120 days, we found they all got better. It was highly significant. And this is the median going down, the right red one. And these are patients who had the higher counts from 10 up rather than just an 8-to-1 or a 4-to-1. We took on patients 10-to-1 and above up to 22 in this particular cohort, and you'll find that in 120 days, their gradient of improvement was obviously better. And now, this is the feedback form we gave the patients. At the bottom, you can see dry blood test 1, after 120 days, dry blood test 2. This is the vagal upload time at the beginning, before they started the oil and the xenobiotic and the lymphatic drainage. This is after VUT2. And we asked them, was there any change? 1, 2, 3, 4, 5 being better, no change. This is no change from the beginning of starting the program, and this is when the change was way better at 5, meaning resolved symptomatology. And we asked them to quantify and measure, did you improve your sleep? Did your brain fog get better? Were you coping better generally, meaning your resilience, emotional resilience was better? Increased energy? Did you get better digestion and bowel function? And did your muscular aches and pains improve? And for patients this is the ones with the N equals 18 anyway. So for all the patients, it was highly significant with a P of less than 0.001. We want to show this. I wanted this slide up because the mean difference between those before and after effect was 6.9, which is large, so highly significant. But for the people with ratios of more than 10 to 1 at baseline for their omega-6 to omega-3, their mean difference was higher, 9.8. You can see this matches up with the slide of how sicker you are, the more evidence you show how you have improved doing a chronic inflammation program. So this is the results on the vascular upload time, meaning how well did the vagus improve, and also how much weight loss or healthy weight did you achieve using this thing for 120, the program for 120 days. We didn't find a change in weight. It wasn't significant at all, sadly, at 0.98, and I'll talk about this in a moment. But the change in vagal tone was highly significant. So the balanced oil and xenobiotic together made a significant improvement in vagal tone, restoring vagal regulation. Most noticeably clinically in the long COVID patients and the chronic stress patients. So those two very important patient types when we are working in primary care. I presented this project to Dr. Paul Clayton and Dr. Colin Robertson in Oslo last year, together with Dr. Makri. And the comment we had from Colin and Paul was that, well, how much xenobiotic did you give them? So Dr. Makri said 1 scoop, and the jar actually says 2 scoops. I think we were considering the cost effectiveness of doing the program, and we felt that 1 scoop should be enough, but Dr. Robert Collins said, well, if you use 1 scoop, you're penetrating only half of the mucosa thickening. Instead of, if this is the mucosal layer, you're only going halfway down, you're not penetrating the whole lot. So since then, I've actually got all my patients doing the program, joining the Metabolic Recovery Program to take 2 scoops a day. So we're gathering more data this year in 2025, and hopefully we'll get 50 patients through the program. We'll do more statistics and see how we go about weight change or weight improvement. So the summary is summary 1 is improved sleep, maybe brain fog definitely got better using the program. Were they coping better? Possibly. Would they get increased energy? Maybe. The digestion definitely got better, and aches and pains got better. So without any lymphatic drainage, their brain fog got better, digestion got better, and aches and pains got better. So quality of life was much improved. And this is our summary too, when we used technology, transdermal lymphatic drainage, to see if the transdermal lymphatic drainage patients who opted for it or who were using the NMTA were told to improve their lymphatic drainage, whether they had a bigger outcome, positive outcome to those who didn't have the transdermal lymphatic drainage. So there was just looking at this with the lymphatic drainage as well as the xenobiotic and the balanced oil. We found that with lymphatic drainage, there was improved sleep, there was increased energy, and there was even better digestion and even better aches and pains improvement. And there's a trend. It's not highly significant. It's only a small cohort of 29 patients. So there was a trend for the patients who had transdermal lymphatic drainage to have improved sleep because their lymph was draining better for the brain functionality and tidying up. There was better energy as well as digestion and improved aches and pains. This is just a diagram to show you what our transdermal laser. I use RJ technology. This is a whole bunch of different laser heads for different things. And the transdermal laser is applied at the radial pulse, and it actually runs a sort of waves of the correct frequencies of the right bioresonance for lymphatic functionality. And it runs through the system and put them on it for 10 to 15 minutes to help lymphatic drainage of the lymph, brain, and lymphatics for the rest of the body. So the conclusion is, after 120 days of balanced oil and xenobiotic, there was significant reduction in chronic inflammation, P of less than 0.001, a very good outcome. The vagal upload time improved, vagal dysregulation was corrected, also highly significant, P of less than 0.001. And then brain fog, digestion, muscular aches and pains improved the most. And when you add transdermal lymphatic drainage as well, there was improved sleep, energy, digestion, and further reduction of aches and pains. So just one more mini project to share while we're talking about chronic inflammation. So let's just have a read. This is the introduction I had in a little project I ran and got published by the European Society of Medicine in 2023. In the introduction, I mentioned the COVID-19 pandemic has opened a Pandora's box of symptomatology, from COVID involving multi-system dysfunction or pathology. And the most commonly reported symptoms are debilitating fatigue, brain fog, shortness of breath or chronic cough, post-exertional fatigue, or delayed recovery from exercise with heart rate changes, meaning it took longer for high heart rate to go down to a normal heart rate for the individual. There was anxiety, there was chest pain, and importantly, there were also balance problems or vertigo. The symptoms are suggestive of disruption in the functional connectivity of the brain, i.e. the brain fog, as well as vagal dysregulation. And there appears to be a gender bias, with women 4 times more likely to be badly affected by COVID. The focus has been on chronic persistent inflammation affecting multiple organs. So this is the project, and this is just some pictures from the publication. It's open access, so if you just punch this in, copy and paste into your search engine, you'll be able to find and read the whole paper. So this is the contour of the ear where the vagus nervous system access happens. And I worked out, this is acupuncture terminology, so kidney up here in this area, and I used the VAS to make sure I locate it carefully. This is looking, kidneys correlates to how the adrenals are running. And on the right side is the liver or the vagal dysregulation measure. You quantify it there. On the left, it's actually spleen. So you're quantifying metabolic outcome, insulin resistant, how the pancreas are running. And between the intertracheal notches, just in the here, in the base here of the concha, is where lung energy is measured to see how lung energy is. One of the things I'm working on this year as well is measuring using an acupuncture point called lung 9, which is at your radial, at the wrist crease, where the radial pulse is almost, or just beyond that. Lung 9 is a point you can, in traditional Chinese medicine, is supposed to correlate to microcirculation. And I can't believe how 2,500 years ago they could have said this, that lung 9 equals microcirculation, but they're absolutely correct. I'm absolutely amazed at how people, the Chinese 2,500 years ago, discovered this. But I now use lung 9 to work out people's microcirculations and how severely affected it is post-COVID, post-viral infection, post any kind of traumatic injury or threatened injury to the individual. So it's a wonderful point. More news about this later. Okay, so if you look at this, this is the number of seconds and in vagal upload time, and this is at the beginning how high it is, and after several sessions, and the paper will tell you about it, I'm able to get the vagal upload time down to normality, which is usually, I would say, 20 seconds vagal upload time is probably the upper end of normal range now. But interestingly, before COVID happened, the upper range of normal vagal upload time was 15 seconds. I find it really hard to get vagal upload times of 15 seconds or less these days, since the COVID has happened to all of us, or COVID vaccination. Now it's the threshold for upper limit of normal is now gone up to 20. Why? I'm not sure, but this is what I'm observing. So vagal upload time will improve after you have intervened. So what this graph tells me is you can be able to predict how long it's going to take till you get someone better. So if Vagal upload time is higher. It's going to take longer. This is how severe it is. This is duration of time. If your vagal upload time beginning is high up, that's going to be the length of time to get better. If your vagal upload time is down here somewhere under 25, you're going to get better with treatment at the excess of the vagus at the concha. You're going to get better in a shorter period of time. So it's a wonderful predictor. Thank you for your time. Just to mention that I'll be in Byron Bay April 16 to 19. That's a beautiful part of New South Wales on the coast. And I'll be in the UK August 20 to September 20. Happy to take questions or meet people then. And in October 2024, Dr. Makri and we've decided to plan for this retreat for September 2026 in Crete. I think we found the venue, the hotel, the perfect beach for us all, and to do wellness there. Wonderful news. Margie Dangerfield has joined the team as well. And the theme is staying younger longer. Thank you very much and good night.